So here we are at Sustainability. Many of you have joined us for the whole series, and we sure appreciate that. It's been fun, and we have had a lot of different speakers, and today Erin Ficker's joining us. I'll introduce her in just a moment. But we are on sustainability, almost finished up. The last one after this will be cultural competence in August, actually, and we'll finish up and wrap up this series in August. So we're looking forward to it. Not to wrapping it up, but we're looking forward to cultural competency and then for those of you who don't know, all the recordings to every one of the webinars in this series are recorded, and they are on our website, and I'll share that at the end of the call. If you are registered for the training today, you'll receive by email a copy of the PowerPoint and the recording. If you haven't registered yet, you can still do that. We'll leave that open until Friday. Also, certificates of completion will be available for those of you who have registered and participated in the training today. And we will send out a link in about a week just to kind of follow up, because what ends up happening if we send them out right away, then we miss people who register late. So we will send those in about a week. And then lastly, the evaluation link, it'll be provided at the end of the training, and we will also email that soon after the webinar ends. And we would really appreciate you completing that evaluation. That helps us to continue to improve the training that we provide. And on that note, I should go back to this slide. We are funded under SAMHSA, and we like to let folks know that the PTTCs are funded under SAMHSA. So I am Wanda West, and I am the moderator. I've been the moderator for each one of these webinar trainings. So you might recognize me. As I said, I'm living in Noble, Oklahoma, so that's where I'm calling from today. I work with the University of Oklahoma, and I am with the South, Southwest, and Mid-America Prevention Technology Transfer Centers. So those of you who have been on before, thank you so much for continuing to join us. It's been fun. And this is Erin Ficker. She was speaking to us earlier, and we appreciate her being with us. She's going to be the trainer for today. She's currently serving as the prevention manager for the Great Lakes PTTC. For more than 12 years, she's worked in substance misuse prevention, supporting communities to use evidence-based strategies, and the data-driven process in prevention planning and implementation. She works with community-level prevention practitioners and schools in the development, implementation, and evaluation of prevention interventions. So as an evaluator, Erin has worked with both schools and community organizations to develop evaluation plans that meet local challenges as well as funding requirements. Erin has a lot of experience in sustainability and has done a lot of work around that. So that's why we've asked her to join us, and we sure appreciate her doing that today. I'm going to turn the time over to her, and we will begin our presentation. Thanks, Erin.
Well, thank you. Thanks so much for the introduction. So I'm going to jump right in. So our objectives today are to define the components of prevention practice that should be the focus of sustainability efforts. We're going to describe 3 approaches to sustainability, describe the ways to increase sustainability from the beginning, and list the best practices in sustainability planning. Okay. You guys have been doing this, right? You have been going through this process of walking through the SPIF and going through each webinar, and you know this flower, I'm sure, inside and out. You probably see it when you close your eyes. But sustainability is central to the SPIF. Literally and figuratively, it is central to the SPIF. So sustainability is in the center. It's there because it's intended to be an overarching theme. It's intended to be infused in everything you do. The problem with that sometimes is that when it's in the center, it also can be forgotten. It can be put on the back burner as it doesn't have its own moment, right? So it's easy to forget about. It's easy to push it back and not think about it. So with our work today, what we're going to spend some time with is really to get you thinking about how to be intentional and to keep sustainability in the front of your mind and have checkpoints throughout the SPIF process to make sure you're thinking about sustainability throughout. So I just want you to remember that even though it's in the center, it does reach out everywhere. So I like to think of in those white spaces in between each step, that's where sustainability is reaching out and saying, hey, stop, think about me right here. I always like to think that that's a good place to have a checkpoint for both sustainability and cultural competence, as that's where they reach out into the process. Okay. So I want to walk you through a framework to approach sustainability, and we're going to start kind of with a definition, what it is, but we really want to move into these three areas, which are the components of sustainability, what are we doing, the approaches to how to do it, what are we going to do, and then the keys. What are the keys to success that you can really make sure you're doing right now? We'll talk a little bit about planning, but that's a whole big thing in and of itself, so we're going to just touch on it briefly. But I really want to focus on these three areas: components, approaches, and keys to success. Excuse me. Okay, so let's dive in. So sustainability. What is it? This is my favorite definition. There's about a million, but this is my favorite and the one I wanted to share with you. Sustainability is a community's ongoing capacity to resolve, to work together, to establish, advance, and maintain effective strategies that continuously improve health and quality of life for all. Is the definition you guys have seen? If it is, you can use the hand raise function and just raise your hand and let me know. Or you can type in, yep, no, I have seen it. The things I like about this definition, personally, I like that it says it's ongoing, it's to maintain effective strategies, not every strategies. So some people have seen it. I'm hearing some people saying they haven't and they think it's beautiful. Oh, thank you, Diane. This is the CDC's definition. And I just love it because it says we're going to maintain effective strategies. I'll get you, yeah, I'll have the citation for you. That's a great idea. It is from the CDC. It is, and continuously improve health and quality for all. So it's really broad. It talks about effective strategies and it talks about being an ongoing process. So yeah, it's not a definition we see often, but I think it's really lovely. So it's like the one I like to keep in the forefront. The other thing I like to keep in the forefront of my mind when I think about sustainability is that it's ongoing work. This isn't something that you do. This isn't a phase of the SPIF that you do and stop and then come back to later. This is something that's ongoing. It's never done. Sorry. No matter where you are in your project, though, the nice thing about it is no matter where you are in your project, you can start. It's never too early, and it is never too late to start thinking about and working towards sustainability. So you're kind of always in this cycle. I thought this picture was hilarious. You're at the start and the finish all the time. So you should always be working on sustainability. So I just want to keep those two concepts in mind, right, when we're doing this work. Okay, so let's just jump in, right? Let's just dig into this framework. So let's dig into the components first. The components of sustainability is what should we sustain? What are the things we're looking to sustain? And there are 3 things that we want to sustain: positive prevention outcomes, effective strategy, effective strategic planning process, and interventions that work. And I want to be really clear that I say interventions that work, and we'll talk a little bit about that as we go. So positive prevention outcomes. It's not always what you think of first, but it's a shift that I want you to make when you think about sustainability work, is that we're sustaining our outcomes. If we think about sustaining our jobs or the funding or a strategy, and that's what we think about first, we're really going to miss the mark. What I want to think about first is I want to think about the outcome. I want to think about what it is I'm aiming to do, and I want to sustain that. And in this work, you know that our long-term outcomes often are 10 years off. They're not things that we can achieve in a short amount of time. So sometimes we're really actually talking about progress towards positive prevention outcomes. So everything you do and everything we talk about from here on out, those things are going to be to sustain, is in the service of sustaining these outcomes. So you have to really in the beginning know what are the outcomes that you're seeking to sustain. And this helps to provide clear link between your work and the reductions in behavior, and then it'll help to make a clear case for why you want to. So I just, long-term outcomes, this is the thing we're shooting to do, right? So super de-duper long-term. Here's some examples. You can type in the chat what are some examples of the long-term outcomes you guys are working towards in your PFS. So if you want to take a second to type in the chat what they are. I gave some examples here: reduction in the percentage of youth who report 30-day use of prescription drugs, or the reduction of number of deaths associated with prescription drugs. These are those long-term things, what you're shooting for. And we need to make sure that this is what's leading our work. Excuse me. Okay. We also want to focus on and think about our short-term outcomes. Those long-term outcomes, again, are things that we probably aren't going to make it all the way to, right? We're looking at progress towards those. So decrease in overdose, fatal and non-fatal prescription drugs. Great. So those are some examples of the work you guys are doing. Our short-term outcomes, and you're welcome to type in some of your short-term outcomes as well. Those short-term outcomes are the ones that we're more likely to have made tangible progress, right? We're more likely to be able to say, we've seen an increase in the percent of youth who can describe harmful consequences of prescription drug misuse, right? We're more likely to be able to do that. And so these become the more powerful ones that we can then link to our outcomes. So this, so we want to make sure we're identifying the ones that we're making progress on and that we've already achieved and how we want to maintain them. Because we have maybe several short-term outcomes that we're working on, but maybe not all of them are working, or maybe not all of them really are, as we thought in the beginning, the ones that we need to focus on. So when we're thinking about sustainability, we want to pare down and think about what we really can focus on. So we may pick 1 or 2 of these that we're really going to focus our sustainability efforts on. But it's important to make sure that they're all linked. It's important to make sure that they're clear. So these are just some examples. Great, Jill says yours are similar. Great, wonderful. So the other thing is that your short-term outcomes are more likely that you'll be able to link them to other public health issues. And the more you can link things to other work people are doing and show people how your work is linked to their work, and the work that we do is to bring greater health to the community, the better, right? So the more you can show that, like, increasing the percent of youth who just display effective decision-making and refusal skills is really good for everybody, then the better off. So these are really powerful. So you want to make sure that you're thinking about them in a way that, and presenting them in a way that can do that. I want to keep moving because these are fun. So those are the outcomes. You want to be thinking about your outcomes and how they're framed for sustainability. And they may be framed a little bit differently for sustainability than they are for your internal conversations or your work that's just focused on your internal planning. Okay, so effective strategic planning processes is the next thing we want to think about sustaining. And this is rarely considered. When you sit down to think about sustainability, you rarely think, I got to sustain the SPIF process. But honestly, it's super important. It's also super hard to build support for creating the sustainability net for it. But this is what got you to where you are. So if you're making progress towards positive prevention outcomes, it's most likely that it was your planning process or it's the SPIF that got you there, right? We know that effective strategic planning processes are essential in helping you reach long-term outcomes. They encourage your process to remain data-driven. It helps to provide a venue for collaboration. It ensures that you continue to stay focused on cultural competence, and it helps to, it continues the process that builds on your initial success. So these are the reasons why you want to do it. But it's honestly, the bottom line is it's what got you here, and it's going to help to keep you moving, right? So it's really hard, though, to say to people, we got to keep this coalition, when really they want to keep the programs or they want to help keep the outcomes moving along. They want to keep the jobs, but you're trying to say, well, we have to keep this. And I want to show you one of the ways that you can do that, and I think it's really fun. This is my favorite slide. I try to put it in every presentation I do about anything. I could be doing a presentation about cooking, I'd put this in. So, because I love the SPIF. So implementing the SPIF process with fidelity. So this is a graph from a prevention program that was done in another state over 5 years, and they monitored SPIF implementation with fidelity. So on the bottom, you see communities that were monitored for the fidelity to the SPIF process. And you see on the right, or excuse me, on the left, the worst implementers, and on the right, you have the best implementers. And then on the up and down, you have low outcomes for their prevention outcomes, and then high. And so what you can see is almost a straight line between implementation, SPIF implementation, and outcomes. So what we see and what we've learned, and this isn't the only example of this, we've seen it in other states, and there's other studies that have been shown, that the more you have fidelity to the SPIF process and the more you are focused on using a good strategic planning process, the more likely you are to reach outcomes. And so you can just draw a line right across here, right? You could just draw this line up here and see that if you implement this SPIF with fidelity, you are more likely to get good outcomes. So I wanted to show you this because it's also a really powerful way to explain to people why it's important that you maintain your planning process. And as we move through this presentation, I'm going to give you some ideas of how you might sustain it. We'll talk about that in a minute. But I just want you to think about that's something that you're going to have to find ways to sustain, is that coalition that you're working on, the work that you do as a coalition to move through this SPIF process. Okay, and lastly, interventions that work. I want to be clear that I didn't say interventions or all your interventions, but clearly interventions that work. Because most important that we look at the interventions that are making progress, we look at the interventions that are having the most impact, that are being implemented with fidelity, and that are going well. It's not all of them. Some of them don't work, and that's okay. It's why we do the work. We test it out. It doesn't work. But we want to make sure that we're focusing on implementing and sustaining those interventions that work. And usually this is what people think about first. They think, I want to sustain those interventions, but really you have to have thought about those other two things first. You have to have thought about your outcomes, you have to have thought about the, and you have to have thought about the process and the coalition that had done the that had done the thoughtful, data-driven process that selected those interventions and linked them to those outcomes so that they would be successful, right, and so that they would work. So now when you think about it as a whole piece, it makes sense, right, that we have to sustain all of those things and think about our sustainability in that frame. You just want to think, too, about making sure that when you're thinking about what you're going to sustain, that you want to make sure you're in multiple settings in the community, that what you are to sustain, right, links to those outcomes. We'll talk about that a little bit later. That they're feasible to implement with fidelity, that you have ways that they can be done, right, that it's not something that there's no way it could be done outside of your work, and that they're already showing promising results. You don't want to work sustaining something that really you're still, after 3 or 4 years, 5 years, not seeing any progress on. So, okay, so those are the interventions. I want to keep moving because I want to get to the how. How are we going to do this? Right? So these are the approaches. So we got through the kind of components of what we're going to sustain, but now I want to think about that approaches concept. How are we going to sustain this work? And there's 3 key ways that we do that. There's adoption, there's norms and guidelines, and there's resources and revenue, okay? And those 3 approaches really work together. You're not going to just, you're not going to just use resources and revenue, which is probably what people think of first, like, I got to get money to keep doing this. Or you're not going to just have someone else take over all your work. But it's really going to be a combination of all of these things that keeps your work moving forward. So we want to look at all 3 of those together. Adoption. Adoption is when prevention practitioners help community institutions assume full or partial ownership of a strategy or process. So this is when, for example, the YWCA takes over your Strengthening Families program. They just take ownership of it. Like, you know what? We'll do it. We'll put a line item in our budget for it, and we've been hosting it. We have a relationship with the trainers. We'll start paying their stipends, and we'll do this. We'll take it on. We think it's important to the community. That's not something that happens at the end of a 5-year grant, right? That's why the YWCA says, let's just do that, right? That's something that happens because you started early, that you started building relationships and planting seeds with those organizations, that you started creating strong relationships, signed MOUs, started actively planning. You want to think about your grant as seeding programs in your community, right? As setting them in and letting them start to grow, and then finding the organizations and letting the community take them over. But you have to be very intentional about that. So this is a great approach. It often works in schools. So if you go into a school and start implementing a program with them, and then really first you start implementing it yourself, then you start training and implementing it with them, training the teachers or training personnel in the school to do it, and then they take it over. So adoption is a great way for you to build capacity in the community. And it's a great way for you to be able to, kind of walk away. Okay. There we go. Norms and guidelines. Norms and guidelines are really when we collaborate with community partners and establish structures and practices that promote healthy behaviors and attitudes. So kind of what does that mean? It means that we are changing, it means that we're changing either the norms in the community or we're changing the policies and guidelines. So if anyone has any examples of norms or guidelines that you're working on or that you have worked on, feel free to go ahead and just type them in the chat. Let me see if you got any examples of those that you are working on. But things like social host laws for alcohol use, that's work that communities did to change laws and enforcement on social hosting, but also to change norms. And in the process, they changed it to say, hey, that's not okay. We want our parents to have a norm that that's not okay. And we also want to make sure that you know that it's being enforced. Another one would be retail beverage server training. We changed the regulations on that. So the policy is now much harder. It's enforced more, on and on. So there's other ways that we do that. Drinking at community events is another way that we change both norms and guidelines. We were not going to have alcohol at our community events, or it's going to be done in a different way. We're going to change the norm about drinking in public, but we're also going to change the regulations and rules so it doesn't happen. So we have some examples. Policy changes in community organizations, working with faith partners to establish sharing through youth group settings. Okay, great. Yeah, so there's some examples of ways, drug take-back days. So if that's something that's becoming a norm, that you are teaching people to return their drugs, that could be an example. That's also something that's a great adoption. If you're doing it and then you get the pharmacy to take it over, you get someone else to take it over. Drug testing policies, working with mental health providers after showing them some of our data. Okay, so another example would be any policy that you put in place. So if you want to change a policy in a community and then the policy's changed, you've changed the guidelines of the community. It's also in an organization if you change the policy in a school setting, if you change the policy in an organization. Excuse me. So the idea is that you're changing the environment, right? And then you can kind of walk away from that because it's done. You may have to put in place some people who are going to do, the regulation, or who are going to do the kind of monitoring of that, making sure it continues to happen. But you're changing the norms and guidelines. Is promoting healthy behaviors too broad for a norm? ATOD would act to derail healthy living. So yeah, it's a little broad, Carl, but we want to get more closer to ATOD use. So changing the norm around it's okay to for teens to drink. So changing the idea that, changing the tobacco age to 21, changing the idea that it's okay for kids to drink at home with their parents. Those are the kind of things that are more specific to ATOD. So we want to be more specific with those. But that's a way to sustain your work. So I decided I wanted to change this. We're going to change it through norms and guidelines, and then it sustains itself. Awesome. Okay, so I want to talk about resources and revenues a little bit because it seems like we're kind of getting the norms and guidelines piece. So resources and revenues are money. Money, money, money. This is what people think about when they think about sustainability usually. They're like, oh crap, I got to get money. But this is when we tap local financial resources to support our work, right? I want to be clear that this isn't something, again, that you look to in year 4 or 5 and say, okay, where do I go for money? Is there a grant? Is there another grant? How do I get this money? This is something you should be looking at for a long time. before. So you should be looking to build relationships with potential funders in the community. You should be looking to make connections with people in the business community, in the banking community. You should be looking to find who are foundations in your community locally or statewide. You also want to make sure you have a clear understanding of what your programs cost, so that when you have an opportunity, you're able to say, this is what I need to run my XYZ program. So I have a program in schools about educating youth on the dangers of prescription use. Here's what it costs. It would be great if you could support this program, and this is what it costs. We also have the same understanding and have a pitch, right? So this is why this work is important. This is how it connects to our community and making our community healthier. So getting that money actually takes a lot of prep in advance and being really ready to go. And a lot of time building relationships and getting people on your team, if you will, and familiar with your work. So you don't walk in cold and say, hey, you've got money, I'm your new best friend. You really want to be able to say, hey, you and I have been friends for a while. You know about our work. Let me tell you a little bit more specifics. I hear you have some money, right? So you want to be able to have a clear pitch, a clear idea, and have been building relationships for a while. And we talked earlier about how you should be linking your outcomes to greater public health outcomes, and that your work leads to healthier communities in more than one way, right? This isn't just for substance use prevention. This is greater than that. So I want, you can think of it that way. So I want you to think of it, be prepared. Find ways to do that. If you're prepared, you'll be ready to make that case. And then people want to fund something that has a bigger impact than just this one area. Okay, so I'm going to move on because I want to get to this next section. Jill, yep, it is definitely a long-term process. You just want to be ready. You want to have all this stuff in your pocket, and it's not easy. And if you're thinking about it throughout the SPIF process, then you are going to be ready. But if you wait and you put it on the back burner because everything else is hard, and it is, I am not saying it's not, but then it's harder to be ready. So what I want to do is I want to get to what's next, because what's next is most important. And this is where I want to have a little bit more conversation. So that's why I've been rushing to get here. So the keys to success. What can I do now to increase my sustainability later? This is, what are you doing now? And this is going to link back to so much of what I just said, so much of what I just talked about. So I want to make sure that we really dig into this. This is the work you do now. This is the work you'll be doing throughout. Okay, so we're going to think about the keys are that you have effective prevention strategies, that you have built and maintain internal capacity, and that you have strong community support. So we're going to walk through those things and talk a little bit about them in detail. Okay. Effective prevention strategies. So if you read through this list, good fit, evidence-based, data-driven, implemented with fidelity, appropriately adapted, culturally relevant. Have you heard this stuff before? Raise your hand if you heard this stuff before. Yeah, yeah. Did you hear it in implementation? Did you, what other steps did you hear it in? You heard it in data-driven. You probably heard it in the first step, yeah? Yep, you probably heard it in planning, right? Probably heard it in implemented with fidelity. You probably heard about an implementation. Yeah. Oh, yeah. You've heard all this. This is just best practice, really. It's doing your work with best practice. And people just, they say this to you and you hear it. So thanks for raising your hands, guys. Thanks for being honest. Yeah, you've heard it before, and I'm going to sound like a broken record, and you're like, why do I have to listen to this again? I know this. What I want to underscore is that this isn't just important so that your work is good. This is important so that your work can continue. Effective strategies have to do this. They have to have good fit. They have to be data driven. If they aren't, they're just not going to work, right? And if you haven't set your strategies up for success and you're not doing these things, they will not be sustainable. Funders do not want to sustain things that have not shown progress. They don't want to sustain things that aren't working. They don't want to fund them. Programs that aren't working, that don't have community support, people don't want to adopt those. It's not going to work. People don't buy into it and change their norms and beliefs when the strategy doesn't make sense, if it wasn't a good fit in the first place. So maintaining your best practices is so important to maintaining the work. It's so important to hit your short-term outcomes and your long-term outcomes, because ultimately if you can't do that, you can't sustain the programs, and you can't sustain the outcomes, and you can't sustain the work in the community. So I'm going to ask you guys to raise your hand. How many of you have, we're going to do a poll actually. We're going to do a poll. So Wanda, can you bring up our poll for us? So while she does that, how many of you currently have a logic model? Currently, for your current work, have a logic model? Be honest, I don't know who you are. So, and you can just vote up there in the top. So I'm not going to send you to coalition prison or anything. Okay. So it looks like the majority of you currently have a logic model, or some of you are saying no, you don't, or not yet, or you're not sure. And that's fine. I'm going to just do my little animation here. So it looks like, yeah, so the vast majority of you, 78%, are saying, yes, you have a logic model. And that's great, because that logic model is key to sustainability, because it's going to keep you, as you see these lines, right? It is going to keep you making sure that your interventions are tied to your short-term outcomes and your long-term outcomes. And if they're not, again, if this breaks down, you're not going to see success in your interventions, and there's going to be nothing to sustain. And it's going to undercut all of the things we need for success. So I just wanted to show this to you again. You've seen it, right? I mean, obviously you've seen it because, 71% of you have one. But it really is a key, and it links back to all the things we talked about earlier. Does that make sense? You can raise your hand if you're like, yeah, Erin, that makes tons of sense. Great. I love it when you guys raise your hand. Thank you so much. Oh, that makes me so happy. Look at all those hands. Thank you. Great. So logic model is key. Setting up with intention in the beginning is key so that you can ensure success, or you can ensure the best possibility of success and progress towards those goals. That's going to set you up well. We're going to move on. Because the next most important thing is internal capacity. And internal capacity is really three things. And these are three things that you're going to need to have, and it's people, connections, and resources, physical resources. If you don't have these, it's going to be really difficult to sustain your work. So when we talk about people, we're talking about coalition members, staff, and agencies. This is the work you're doing now, making sure that you have all of this set up, that you have connections to individuals and agencies and resources within the community and within your agencies, that you have the things you need to do the work. And physical resources. Do you have the space, the equipment, the data, the information? If you don't have these things, the work's going to fall apart. But also, who's going to fund someone who doesn't have this, right? Who doesn't have infrastructure. Essentially, this is like infrastructure. So if you don't have that infrastructure, funders can see it. They can smell it, right? And if you don't have it, not going to have a lot of success. You're not going to have a lot of success doing your current programs, but you're also not going to have a lot of success selling your programs and your work to funders. They're just going to they can smell when you don't have this. So this is something you really want to work towards building. And you can think about how you can make sure you have that. Okay. So the last thing, and so this is really the work you do through this process, and a lot of this happens in step 2, is building this internal capacity, but it's something that happens throughout too, and you have to keep going. And it's essential that you keep it moving. But what about in low capacity communities? So that's we're going to get there next. But in low capacity communities, it's really your work to build this, and that's a lot of the capacity building steps. That's a lot of the work that you will be doing, is to build this up. And we're going to talk a little bit next about community support. So I'm going to get to that. Thanks for that question. So community support is the third thing you need in order to have success in sustainability. And so we were going to have we're going to move to 3 chat boxes for this. So we could, were we going to do that one? I can't remember. But let's talk a little bit about these 3 parts of the.
I don't have that set up, but I can do it really quick.
Okay. So I'll talk about these 3 types of support. So there's community members, which is, the large population. Do they know about your work? Do people know about your work? Do they understand the importance of it? Do they support it? Do they not support it? Another problem. Then they have your key stakeholders. Those are the people who care about the priority problem. They have something to gain or lose from your efforts. They can move your prevention efforts forward. They're people who you need, right? And then there are champions. And these are high-profile people. These are the people who can move your work forward because they are there or because they speak for it. I mean, these people are important. So we need to have these 3 people, and probably in this number, like this pyramid kind of says the numbers of these people. So I was going to ask you guys in these chat boxes, and we'll do it in the order they appear in this chat boxes, right? The chat boxes go along with the champions at the top, key stakeholders in the middle, and community members at the bottom. Give me examples of champions in your community. Give me examples of key stakeholders and examples of community members. Because, community members or groups, community members are more like groups, right? Who would be a group that you would need to work? So mayors, directors of schools, superintendents are champions. Superintendents are great champions. Sheriffs, mayors are great. So lots of champions coming up. Parents are great community members you got to have on your side, right? If you don't have them, oh my goodness. And then specifically someone that's in key stakeholders is PTA, which is a very specific key stakeholder group. They have something to lose and they're important to you. So school personnel, faith leaders are good key stakeholders, business owners, and they definitely have something to lose. Tribal council members are really important champions. They can definitely, kind of win or lose for you, right? They can speak to your work. Mental health departments are good, great key stakeholders. These are great. You guys are giving great examples. Recovery community and the greater community members are good ones. Oh my gosh, I'm never going to get through all these. These are great, you guys. I love this. Coalition members, schools and tribal communities. While you continue to type, I'm just going to say this is really important that we think through these populations and how they affect our work because we need their support. We need community members to believe in our work and support our work. If we don't have it, funders are going to say, well, nobody's behind you, right? Nobody agrees with this. How are you going to continue to do this? You need the key stakeholders because they're key. No pun intended, but it's true. They're going to help open doors. They're going to help support the work. They're the ones who are engaged the most. They're probably they have engagement on your coalition. They're the people you turn to. They're going to help move this work forward. And then if you have champions, those are really great. Champions are going to help you get funding because you can say, the mayor supports us, or the sheriff is on board, or the superintendent has our back. So it's really important to have this community support, and without it, it's difficult to get funding from local funders. Also, it's helpful for adoption. If you can say, the local YMCA is totally on board, it's easier to get another local youth serving organization to get on board. So the more people you have on board, the more people come on board, right? I love that. So this is great brainstorming. I just absolutely love it. Love to see all these ideas. Okay, I'm going to just, while you guys are still typing, so go ahead and keep typing your ideas, or if you're done. I want you to think too, and I love this slide, and you've probably seen it. If you haven't seen it, welcome to my favorite slide. If you have, it's always a good review. So these community partners are at different levels of engagement at different times. So you don't need to have the mayor collaborating with you at all times. You just maybe need the mayor cooperating with you at certain times in your work. You need the PTA networking sometimes. Sometimes you need them collaborating. So these stairs, I like to think of them as a staircase that you can go back and forth on, from no involvement, networking, cooperation, coordination, and collaboration being the highest level. There are people who you are going to walk up these stairs, get to collaboration, hand them the program, and send them on their way because they are the people who you want to adopt the programs. But there are a lot of partners too who you're going to kind of walk up and down the stairs with. Oh, thank you for champion. Thank you for being in cooperation or coordination with me right now and making an announcement about how much you love my work. I don't need to see you again for a while. There are other people who you need to keep in those middle stairs all the time because they're helping you with the work. But I just wanted to show this again because I think it's an important reminder that that community support kind of lives on these stairs. And if you need them involved, they don't have to, you're going to have to build this involvement and nurture this involvement throughout the process. It's kind of overwhelming, but I like to think of the levels of engagement as kind of giving you a beat to say it is overwhelming, it's a lot of work, but you're not walking everybody up to the top of the staircase. So it's okay that you don't get everyone to the top of the staircase by the end of this process. The idea is that you're moving them back and forth. So I just wanted to show you that levels of engagement. And the last thing I'm going to do really quickly, because quite honestly, planning for sustainability is its own huge thing. But planning for sustainability is kind of, how do I start creating the sustainability plan? And my husband works for the DoD, so I have to say, failing to plan is planning to fail. He likes to say that. sustainability planning. So sustainability planning is, and I teach a full one-day course on sustainability planning where we go through a whole elaborate process on how to really create a plan that then you use to build support. So this is just a quick review of the things you might do or need to do as you're moving through your SPIF process to think about sustainability process, or planning, excuse me. So sustainability planning, you want to make sure you're reviewing your data regularly and you're keeping good records. So all the records you keep about the work that you're doing will come in really handy if you're going to write a sustainability plan, because you want to be able to tell people where you've been and where you're going. You want to have a sustainability subcommittee if possible. If your coalition is big enough or active enough to have a group of people who are kind of actively keeping their mind on sustainability, they can be keeping good records, they can be monitoring kind of these components of sustainability success and moving forward with a sustainability plan. You want to conduct regular sustainability check-ins. So if you have a sustainability subcommittee or not, they're going through a process of regularly throughout the SPIF process doing. So you also want to set goals. You want to set sustainability goals. So you want to set little goals throughout for what you're going to do. So we're going to set you can set goals, but that's important to your planning process. And then you want to determine feasibility and resources. So this is what I said earlier when we were talking about resources, is that you need to know, is it feasible to continue to do this program without your current funding, and what are the resources required? So that if someone comes to you and says, I will provide you support, you can say, here's what it costs to run the program. So you always want to be, able to talk about what it costs to do your programs. And then you want to make a plan to sustain each strategy. So those are all the components, a lot, of what a sustainability plan includes, and some of the work that you can do now to start thinking about that. And like I said, it's a whole other training. It's a big piece of work, and I would encourage you to look into that at some point, because I think it's really useful. But this was just a taste of sustainability today. So I'm going to turn it over to some questions. And I know we got some questions as we were going along. So
we did. So we have, let me look and see what we missed. Okay, so going back to adoption, is that one of the questions we had, is that a subsection of dissemination?
So if I'm understanding the question correctly, I would say no. Adoption is really someone taking over your program. It's not really disseminating. I would say dissemination might be more in the realm of norms and guidelines, but adoption is really its own concept. And yeah, so I know.
Okay, so if that doesn't answer your question, give us some more clarification in the chat box, and we can add more to that.
Yeah, so if I didn't get that, let me know.
Trish had a question. So if asking the school to add prevention education, should we be working with the school system and county for budget guidelines, or going to the state legislators to ask for them to add funding to school budgets?
So that would be really cool. I wouldn't say you should be doing that. That's one way to do it. So in some places, having schools adopt and take on prevention education in the school system is a good approach. In some places, it's not. I have seen counties in my state totally take that over. And I have seen counties for 20 years provide the prevention programs, the prevention education programs themselves into the schools. So it really depends. I think, kind of going that route and talking to the schools about what would work for them makes sense. I would think about, but it's really what makes more sense for you. So adoption may not be the right approach for your prevention education program. It might be. It might be that you just need to find someone else to pay for it, or you need to find a way for a different agency to adopt it. It may not be the schools that are the right ones, or it may be. Those are all good ways to think about having the schools adopt it. I hope that answers your question.
Okay, and then the next one is from Ben. I had a question or I had a comment that they couldn't hear the questions very well, if they could be kind of repeated before they're answered. But are there any ideas with COVID-19 how to get more coalition support by funders and interaction from people in general within a small community?
Oh, that's hard. So I've been talking to people a lot about this, and we don't have great answers. So because COVID-19 is taking a lot of community attention and support right now, it is hard to get funder support. We're seeing a lot of funders turn their attention to things that are immediately focused on COVID-19. So I don't have great answers for you, except for, again, the more you can think about positioning your work as being for the health of the full community, the better. So I wouldn't say, don't say, well, we address COVID-19, because obviously that's disingenuous, but to say that, you know, COVID-19 is affecting substance use in our community, and that's concerning, or to talk about how your work makes for a healthier community in general, I think it's good. It is really hard in a small community where we talk about your coalition is made up of what we call the STP, the same 10 people, as every other coalition. So it is a really, yeah, with the STP. So it is a really difficult situation, and I don't have great answers for you. But I think positioning yourself as supporting that other work, talking about how COVID-19 is impacting your issue, and thinking about how your issue, substance use, impacts the general health of the community are the best things I can say.